I've been told many times that community is a generic word and we ought to change our name. That's not true. It's what we are. And what's really interesting in vitalizing is the fact that we really don't know them and they don't know us. They trust us and we love them and we wrap our arms around them and we have all kinds of services that we provide. But whether you're actually a direct caregiver or not, they can feel you. They can feel your zest and your love for them.
If you don't believe Community Health Network CEO Bryan Mills' assessment of his team's mission in healthcare and service to community, then listen to Jacob and his take on the care his wife received at Community's Cancer Treatment Center.
Community MD Anderson did a fantastic job of making us feel comfortable at every step of the way. It was a very personalized experience that she had. Like when she would go through her treatments with her nurses, they knew her by name and they would always try to make it as positive as possible.
More on the MD Anderson Cancer Center connection, Community Health Network's growth and presence in Indiana, and the visionary who's been there to move the needle forward for the past 40 years. Retiring Community Health Network CEO Bryan Mills, my guest on this week's Business and Beyond podcast, presented by PNC. And I'm really pleased to be joined on the podcast this week by Bryan Mills, the longtime CEO of Community Health Network here in Indianapolis and a good friend for a number of years as well. Bryan, how are you?
I'm doing well. Thanks, Gary.
Now, what is this retirement thing? You're too young to retire.
I think tired would be the right word.
That's good. I know you've been a community and really shepherded incredible growth over some 40 years at the hospital, arrived there as a controller. And when you arrived at Community, it was just one hospital.
Right. It was East, what we call East now was there. That was Community Hospital that was built in the late 50s. And we've since rebuilt that. But I was part of the team that came for Community North. And one thing about that, Gary, is that I never thought I'd worked in healthcare. I was an accountant, and my boss took a job to be the CFO and asked 3 of us to come with him. And that's how I got here.
That's interesting because I'm always interested in the career path that people take. So you, again, as you say, healthcare was not on your radar. It was really, you were an accountant by education and by trade, and you expected a long career in accounting.
Yeah, I interned with what is now Ernst & Young, and there's a whole story related to that. I never thought that would even happen either because I didn't want to be in the big 8. I wanted a small firm. But I ended up with an internship, totally different story. And I was part of a team on this internship, and we were at an insurance company. And when we got done with that, I was supposed to go to a bank, and they said, "Why don't you go to a hospital?" I'm like, "What the heck is a hospital?" They took me to downtown Gary, Indiana, Methodist Hospital, Gary, and I fell in love with healthcare there. And it wasn't because I knew anything about it, but you park your car in the lot, and you walking with this herd of people. Didn't know them, but they're talking about this and that and what they're going to do. Sometime later in the day, you walk back out and with another herd, and they're talking about what they did. And I just thought this was amazing that people came to work to help other people because nobody in my family had ever been in healthcare when I was growing up.
Wow. So is that helping people aspect? Is that what really got your attention?
Yes. It was the idea of people serving people. And today we're not much different.
Yeah.
And so I did that internship, and then they offered me a job at Ernst. And I said, "Hey, I would like to specialize in healthcare." So I bebopped around the Midwest for a while. And then my boss took a job as the CFO at Community, as you said, one place on the east side. And he asked me and 2 others to go with him. And I said, "What would I do?" And he said, "Well, they're building a new hospital in the middle of nowhere. It's going to be north. You'll be the finance guy up there, the accounting controller." I was 24, Gary, and I said, "There's no way. There's no way. I'm not qualified." And he said, "You'll be okay."
Wow. Wow. What'd you think when you got into it? And that whole process, it had to be interesting going from the one hospital on the east side to this new, and you say in the middle of nowhere, and it really was essentially, but it's hard to believe now that basically 82nd and I-69 was the middle of nowhere.
Yes. The Fairbanks Recovery Center or Fairbanks Hospital was there a few years before us. And then we also, part of Community North was a new behavioral health hospital that's still there now. Nobody was ever more excited to have all the patients and staff from the east side relocate to the north side. I remember standing out on the street and we're applauding and welcoming people there. It was just, and it's all joy that we're trying to find ways to help people.
Yeah.
Yeah.
As you look at growth, generally speaking, from that one hospital that you joined some 40 some years ago, talk about community today, the footprint, generally speaking, in terms of hospitals and care sites that you have, because obviously community is a substantial player on the Indiana health scene.
Yeah, Gary. I mean, it's surprising how many places we've gone and what that's a part of us. But the backstory of most of these places we've gone is that they were not financially solid for a lot of reasons. I don't mean that critically at all, but we acquired things that weren't working because they were providing services in their local community. And whether that's Anderson or at the time Greenwood, where South is right now, Kokomo, there's other places that had facilities. And we, over a period of time, absorbed them into our organization. And somebody would say that we're all one community. To some extent, yes, but each community is different. And they're neat. If you think about Anderson and Kokomo and what those places used to be, Noblesville High School, I just remember going to Anderson, Kokomo, Marion, Newcastle. We're going to get our butt kicked.
Yeah. Those are some great basketball towns for sure.
Well, and other sports as well. And then all of a sudden things change. And I'm not criticizing anybody, but it changes. The people are still there.
Yeah.
And the people need assistance. Yeah. And people have asked me for years, when is I going to change the name of community to put a real name? And I've always said, it is a real name. We're here to serve our community. In whatever communities we're in, we're involved with the government, the school systems, all the foundations, local organizations. We're part of all those things. And that's what we're supposed to be. We're supposed to be like education. We're part of that. We got to be there. And we have all kinds of ways in which we try to help education, make sure kids are in school.
Yeah. I thought that was an interesting item I did read as well. You mentioning that the need to keep that name community because it is about community. So much has changed, obviously, in healthcare on multiple levels. As you look at your 40 years in healthcare, are there one or two areas? What do you think is the biggest change that you've seen, that you've witnessed in healthcare delivery?
It's hard to say one thing, but there is a whole lot of specialization, and that's good. Probably the biggest thing is probably similar to the rest of the world, data. It used to be, if you're trying to figure out which doctor to go to or which place, who's done the most, who's done this, and I'm not saying that was good or bad, but now we have all this data, amazing amount of data, and people learn from it. And we also have physicians and nurse practitioners and others on our team. So we're working as a team. When physicians come to work for us now, we have these programs, leadership programs that they go through. Because if you're going through medical school, you're not doing this, but all of a sudden you pop out and you're now the leader of your office or whatever it is. And so it's been wonderful to have all these geniuses, in my opinion, go through this, but then learn. What does it mean to run an office? What does it mean to have partnerships? What does it mean when you have people helping you? And that's just people respecting one another.
Yeah. You mentioned data, and certainly technology has transformed all industries. As you think back to 40 years ago when you first got into the healthcare industry to today, how radically and in what ways has technology improved? I would assume mostly for the positive. Maybe there are some negatives, I don't know, but how has technology changed your job and the healthcare delivery system?
It is paramount with everything we do. I mean, in many different ways. Whether it's us taking information, a patient comes in, we can go to an electronic medical record, we can get all this data, we can figure out if there are other places they've been, we can call that data in. So somebody's actually using what's in there, because two people, an example here is my wife's an identical twin.
Oh.
Okay. She and her wife are still her sister are still very close. I remember during COVID, one of them got COVID, one of them didn't. And I talked to a doctor. I said, does that make sense? He said, yeah, it really makes sense. From the time that they left each other, because one went to Texas and one's still here, my wife, and they're back now, but they changed their environment, where they went, all this changed. That was probably a duh to most people. To me, that was like, oh my gosh, never thought about that.
Yeah.
But when you're doing all this and you're trying to figure out how you provide services, it comes into play from the clinicians, not from people like me. I run a business. I'm not qualified, but using all that information in a positive way to provide the best outcome, it's really a head scratcher to say, boy, how did we do it before?
In terms of technology, certainly artificial intelligence is here. It's going to be even a bigger part of basically everything we do. And I know in doing some background for our conversation, Bryan, I ran across some information that community has used AI to really save a lot of money. It's been a cost cutting, or I should say, an efficiency tool for the hospital. In what ways? How does that work?
Well, a few things here. First of all, in technology, I'm jumping away here. When I think of technology, the first thing that comes to me is the first time I watched a robot do surgery.
Oh, yeah.
You talk about, I'm in a room, a doctor was a fraternity brother, said, hey, you got to come see this. And it was the most still is amazing that somebody's not over the patient. They're in the room, they're going through and utilizing this robot, and you get better outcomes in many ways. So that's one piece of it. The other piece of it is, as we've gone and we've taken our teams to Microsoft and Epic and other places and saying, we've got all this stuff going on. We can't just keep adding cost. We got to find some ways to use this. And I think we're still trialing a lot of that, but we have found ways to do it, especially when we get into how we identify what are the important parts of somebody's records and how do we do that together? How do we share information? How do we identify? Here, a good example would be when a doctor was in a room, instead of taking notes or writing something in a folder, we're using an EMR. If the doctor's going to have a good experience with the patient, they need to be looking at them, listening to them. They don't need to be trying to figure out how to use that. So we used to have scribes in there, okay, which made sense but it was also very expensive. And so now we have literally bots in the ceiling, and they're doing all that. And when you look at what they do, they have this amazing ability to say the medical things go in the file, the other social things, personal things like that don't are not needed for the healthcare delivery, they never get in there. So that's one of those AI things that's just, wow, that is amazing. And I think that we're going to continue to find more and more ways to distill it down to what we need versus having all this volume.
Yeah. You mentioned the pandemic a moment ago. Talk about what that was like managing a major health system through the pandemic. Had to be an enormous challenge.
You bring back those times, I was one of the first people in the state to have it. I'll never forget when on a Saturday morning when a couple of people knocked on my door and I opened it and I said, come on in. They said, no, you're stepping out.
Really?
And so that's during COVID, we learned so many things. We have this relationship with MD Anderson, and I could tell a long story about how that happened. But one of the things was we were trying to go through and enhance our relationship to be a partner. They got a handful of partners in the country. They're all academic medical centers, except for us. But you have to embrace their protocol, the way that you got to change how you're doing everything. And you had to get all these doctors together to do that. We achieved this because of COVID. Because in COVID, you couldn't get together. You got on these Brady boxes and could do things. And we were able to accomplish what we had to do through COVID because of that. And so to me, that's a positive in COVID. I don't have many positives, but I will tell you this, one of the coolest things that come back to me, Gary, would be, I can remember I'm in my office right now. My assistant walked in and said, Bryan, there's about 30 doctors in the foyer. They want to talk to you. And I'm like, are you kidding me? This is going on. We're trying to fight this. And I got a bunch of people down here that want to yell at me about something. But so I walked down there. I said, so what's up? And they said, we're here to work for you. We're employed by you. We can't do what we do. What do you need us to do? And you can name anything. You could come up with any question about did they do this? They did all of it.
Wow.
And it was, and so the teamwork that happened there is still here today. When we got challenged, are we really a team or are we not? And we became a team. And tragedies in there, which is just awful. I required all of our leadership to go do the same thing. I was in places I've never been before, and I know a lot more about what goes on in ER than I did before.
Wow. Yeah.
We needed to go, be seen, be a part of it. And I'd say we're one of the few organizations, if you look at our leadership, we all went into it, through it, and are still here.
Yeah, that's great.
Which makes for really good ongoing relationships because obviously we can talk about anything at this point.
Yeah. Was there ever a time during that process when, gosh, you didn't know that there was any light at the end of the tunnel? You wondered if, everybody's going to come out of it?
I don't think we spent that much time thinking about that, or at least I didn't. It was like, it's another day. Here's what we're going to do. We keep learning things from places. But I have more good stories. It's about what people did with their heart, what people did to assist, to find any way to give me something that I can do because I just can't. I work in healthcare and I just can't just sit here and watch TV. And we just got a really positive relationships in a whole lot of places because you get down to people cleaning rooms. It became different in the mask and everything. And some of the stuff became political, which was unfortunate, but that's our society. We don't get wound up about that. We're just going to go do what we do.
Mm-hmm. What you mentioned the partnership with MD Anderson, the Houston-based cancer center, which I think is that the largest cancer center in the country?
I'm not sure about
certainly one of them. Yeah.
The reason they had this program, and again, long story to get here, I won't go through, was I did not know that MD Anderson was actually a department of the University of Texas.
Oh.
Okay? It's not its own entity. And by virtue of them having having all these things that they want to spread, they cannot own assets out of the state of Texas. So they put together these programs, not only in the United States, but worldwide. So they can take their know-how, their science, their research, the way to deliver, and they're looking for people that are willing to follow that standard. And it's just been amazing. And when we achieved that status, we had a big gala one afternoon out at Hunter Prairie. It was really cool. And I'll never forget our lead doctor, medical oncologist, when he took the mic, he said, "This is wonderful. We've accomplished this. We're going to stay with this. And this is why we're doing it." But he also said the most important thing to me, and I had no idea he was going to say it. He said, "If you have a cancer diagnosis, we will see you within 48 hours. My jaw dropped because that's what we should be doing. Now, we have a lot of people now that say, I can't get there in 48 hours. The point is, we're here to start. And we can't provide services, but we can start walking you through what's going to happen and what do you need. That piece of it has now spread to other parts of our organization. I didn't edict any of this stuff, but said, hey, that's a good idea. And that to me is what changes healthcare. When all of a sudden you have people coming together, locking arms and just saying, we're a team, we're here for you.
Much more ahead with Bryan Mills, the retiring CEO, longtime CEO at Community Health Network, based here in Indianapolis. We'll talk about the state of healthcare in Indiana, Bryan's career journey, and a lot more when the Business and Beyond podcast returns.
At PNC Bank, we're committed to making a difference in the lives of our customers and communities by helping them move forward financially. As a Main Street bank, we try to do right by our customers with every encounter. Our local teams offer personalized financial advice to help guide you in making the best decision. We're proud to be part of your community. PNC Bank. See how we can make a difference for you at pnc.com. Copyright 2022, the PNC Financial Services Group, Inc., all rights reserved.
We build Indiana. The Laborers International Union of North America are men and women building roads and bridges to get Hoosiers where they're going today and a new energy infrastructure that will keep Indiana competitive tomorrow. LIUNA's over 12,000 statewide members also grow local economies, earning good union wages, shopping where they live and work, and paying taxes. We build Indiana for good jobs and stronger communities. The Laborers International Union of North America. We are LIUNA.
And welcome back to the Business and Beyond podcast presented by PNC. My guest this week is Community Health Network CEO Bryan Mills. Bryan has been with Community for some 40 years, retiring after 4 decades of service and shepherding really Community through some pretty substantial growth. And Bryan, as you look at the state of healthcare, if you will, in Indiana, how would you assess it? It's a complicated, rapidly changing industry, certainly. But as you look at Indiana and the state of the healthcare delivery system, how would you assess it?
I think that there's a lot of splits and people look at things differently. That doesn't make anybody a good or bad person. And then different organizations are involved here, and whether it's big pharma or whether it's device manufacturers or insurances or hospitals and health systems or doctors, there's just a lot of pieces in there. I think people believe from their lens, this is what needs to happen. And I didn't even mention you get the government involved, and government's always going to be involved because Medicare and Medicaid are government programs. It's almost 70% of our business, and we're aging, it's growing. And as we spend time together, I've always said, if we could just get everybody in a room for a weekend that can make decisions, I think we could put together a plan, because I think the Hoosier approach to this is doing that, could do that. But we get a lot of finger pointing, and I just don't think that's healthy for our state or for individuals.
As you look at challenges, certainly one of the challenges for all industries, including healthcare, is workforce. A lot of talk, obviously, about nursing shortages and all the types of things that go along with that. Tell us what it's like. How challenging is it, in particular, in the nursing area, to find people to put to work?
Yes, that's true, and we will continue to have those issues and concerns. But I would highlight a program like the relationship we've had with Ivy Tech for years. And Ivy Tech, they have a program with them that help, and we're not the only people who does this. So if somebody's an MA and they want to get to RN, we help them do that financially and also in getting their experiences. And what I've always said to our organization is that when an individual needs to have their time in a hospital doing something, we're open 24/7. Whatever time they pick, we're going to be able to provide it. Because these people are trying to change not only their profession, their life, their family, and they are actively determined. And when I've been around these people who are advanced, it just warms your heart and says, how cool is this? We've had a bunch of people go through that and over life, they can do it. And I think that there's even more things that we can do as a large employer with education to say, how do we work this together? And how do we put this together from the best interest of the student as opposed to community? And I just think that, like many things in a roundtable, you get people in here and we get past what we need to what we all need. And I think we can do that. We can address these, because once you do that and you're not this professional, there's all kinds of things you can do. I have no doubt that there'll be a day then somebody will give me a name, MA to nurse to doctor. Because MA to nurse practitioner, we already have that. Mm-hmm. It's just so that find the joy, understand the problem, get people together, everybody put their ego down, and let's get this done.
Yeah, it sounds to me that you're a big culture guide. Is it very important to you? The culture, the mission, the vision, really, of the system is what's important.
I named myself the Chief Culture Officer because really in my role, that's what it's about. We have new employee orientation every Monday morning. Okay. I'd say average would probably be 50 people. Sometimes it's over 100. Sometimes it might be in the 30s. I go there every Monday to welcome the organization, make sure they understand who we are, what we're doing, why we need them. They see me in a Walmart or a ball game or something, come grab me. You want to have lunch in the cafeteria? Let's talk. We're just people serving people. And so therefore, we just need to get people together. And I've had so many, and I act like it. I said, everyone, if I'm out of town, I don't go. But if I'm in town, I'm at that orientation. And I also tell them my story, which is, I came here and here's what I did. This is what's happened. Anybody can do this. It's come here and let's get involved and let's help you grow and develop. Yeah. So I think the culture piece, and make sure people understand our mission, vision, values are not just words on a wall. Our number one thing here is patients first. I mean, it's that simple. People say, what does that mean? I said, it means what it says, patients first. We got to figure out what we do, how we help. But if you don't get to know the person, you can't do that. You can't just be the next one up.
Yeah.
Well, and we're not perfect by any means. We've got all kinds of things that we continue to do, but that's what we focus on, as well leadership training internally, making sure we have common goals. Like I said before, education for nurse practitioners and doctors and everybody else to say, okay, how do we have a culture that we all buy into?
Bryan, as you reflect back on 40 years at Community, do you ever think of legacy? What would you like your legacy there at Community to be?
I really haven't thought about that, Gary. I would hope that people would, it's not about how many hospitals, it's not about how many buildings, but it is, how do we change lives? How do we create an environment that people want to be there? Everybody's got to work, or most everybody's got to work. Let's make this something that we want to do. And that's where I get back to the culture. And I think the other thing is you have to be involved as part of whatever community you're in. And I think it's important to do that. There's so many friends or mayors or superintendents or principals. And because we're trying to say, what problems do you have? How can we do this together? I never forget my sister's 40 plus years in education. And when she figured out that she could actually have an appointment and go to, I didn't do it for her, but have an appointment, doesn't have to take off, doesn't have to be away from her, and she's special ed teacher, that she can go down there and get this thing done. She said, "Well, brother, you finally did something."
That's good. That's good. I don't know what's next for you, Bryan, but I hope, because I know one of the things I always found interesting about you is you and I think you and your sons would always go, was it the SEC tournament every year? You would go down and witness that?
Yeah, my dad took us in the early 90s for the first time, and it's grown now. So it's our kids, my sons, and then other males and their sons. Well, there's a few females that come. Yeah. But it's just a time to get away.
Yeah.
And the basketball is fine. We do that and we have that, but it just really is about just having people who want to be with each other. And we've been doing it now. We're probably 20 some years.
That's great. Bryan, it's been great to catch up with you. Congratulations on the retirement, and especially congratulations on 40 years of really making a difference at Community, growing that health system, being a part literally of the community. Really appreciate it. And I hope to see you soon.
Yeah. Thank you so much, Gary.
All right. And thank you for listening to this episode of the Business and Beyond podcast presented by PNC. We're a weekly conversation with achievers in business, sports, entertainment, and beyond. And you can download all of our episodes at InsideIndianaBusiness.com, where you can get business news 24/7, everything you want to know about what is going on around the state of Indiana. I'm Gary Dick. Thanks for joining us. We'll see you next time.